Good afternoon, I'm Mabel Jong, and you're watching the afternoon session of the World Healthcare Congress Interview Zone. And right now we have Joanne Anderson here with Teleperformance. We're going to talk more about consumerism and how really to give consumers what they want. Joanne, thank you so much for your time.
Thank you.
Now, Joanne, it seems like from what I'm hearing at this conference, we know a lot about the consumer.
Right.
There's a lot of energy and resources being thrown at finding out who this person is and finding how best to engage him. Now, what do you do with that information?
Right. So I think that's the first step, is identifying what it is that that member wants or that patient wants, to make it personal, make it specific, make it easy to understand. And I think by using multiple types of technology, that's how it's going to work, and not one size fits all for every application. So last year with ACA, we ended up with 14 million new members that had never been part of the system before, or may have been out of the system for a while. And they started going to the web and using the web to apply, and the web didn't work. And so what it did was it programmed them to then have to call. And so what we saw this year is more members calling rather than even trying on the web, which was discouraging because we've come so far in the technology now in using that. And so I think we have to reprogram or build up the confidence of those members or patients again by taking the information that we know they have. We know what their preferences are. So if we want to get them into some kind of educational program, or we want to bring in our rewards program, we could potentially email them and say, here's the program, go check out our web for it. Mm-hmm. And I think once they see, okay, that they knew exactly what I was looking for in a rewards program, mm-hmm. or that I received a free gym membership. Mm-hmm. And by then going to the web, you're now, the next time they're gonna go, oh, I noticed this. And so you start to reprogram, I think, our members and our patients to see that there are multiple channels. And then we can go to the next step, even with mobile apps. Why not use SMS? And if you have their cell phone number and they've allowed you to use it, that you can send an SMS message back to them to remind them of their doctor's appointment or instant refill on their prescription, which is all about helping our members mm-hmm. stay healthy and get healthier.
And are you confident that consumers want to have this information sort of pervade their personal lives? And also, is there a danger of information fatigue?
Right.
Do you know much about that?
I think that's a great question. And I look at the retail and banking, and there is a variety of uses by banks. You can do your mobile, you can pay by, do your check, or you can pay by your credit card on your phone now. And there hasn't been fatigue. I think there's been more and more and more apps on the phones to use that. And I think that equates also to retail, where if you buy something, you're instantly going to get a lot of emails after that. Do you want to buy this? Do you want to buy this? And that, I think, is where you get the fatigue, because after you get bombarded over and over again, you're probably not going to read them, and then you're going to put it into your junk mail. Mm-hmm. So I think you have to be very careful about what and how often you correspond back with the member or with the patient, and do it in something that way that they have asked you to respond to them. So an SMS for an appointment, or education by pointing them to something new on the website.
Well, that's good information. Any idea, does Teleperformance know how often you can do this with a customer before it gets to be a little bit too much?
And actually, because we span 35% of the world's population across 15 different verticals, we have clients in retail, we have clients in banking, we have many clients in healthcare. We can see the preferences of how often they want to be communicated with, and we can look at the data over time to see what works and what doesn't work. Mm-hmm. So we know when to use SMS, we know when to use email, and when to use an outbound call for a specific type of personal communication.
Okay. What are the clients most interested in doing aside from engaging consumers right now? What are the top top questions they have for you that they need assistance with?
Our patients and members. I think they're very curious. We've now with ACA, we have a lot of new entrants in Medicare. With the aging population, we have the states extending Medicare in, I think, 26 states, sorry, Medicaid in 26 states. A lot of questions, a lot of new members, and we're trying to dissect the calls. And so doing an outbound call, a friendly reminder that your premium is due. Or when they call in, we give them a little information about, okay, do you understand that your out-of-pocket costs are this? And do you understand co-pays? And let me just talk to you about those things with a little bit of education. And so you can start to then customize. If they're already paying their bill, you don't need to bring that up. If they're not enrolled in an employer program or some type of reward program, or you do notice they have a chronic condition, you offer them to speak to one of the clinicians. So really listening to what the member or the patient is asking for, and then looking at the data from previous calls and really tracking it and customizing it.
Okay, so still, it's back to the individual, the consumer, back to really trying to engage this person. So that's a top priority. What has dropped off the radar a little bit? What is not so important as a top priority now?
I don't think we're there yet.
Okay.
I really think that the whole healthcare industry is changing so much, and the consumer-driven or employee-owned part of the bill is becoming more and more prevalent. And I think that employees are seeing these huge deductibles, and they're not understanding, and they need us to help them navigate through the system. And I think by asking those kinds of questions or anticipating those questions they're going to have, there's going to be less surprises. Or if they call up to look for a dedicated provider in their network, remind them, oh, well, are you going in for this procedure? By the way, we have a cost estimator that you can use. Would you like me to walk through that? It's doing that little extra that you know you're going to eliminate that future call or future disappointment.
Okay. And speaking of cost, health plans, of course, are going to be looking at the bottom line more closely than ever.
Right.
So what are they doing or planning to do to try to trim down those operating costs?
Right. That's a tough question, because I think as your perception is to improve customer service or consumerism costs more money. But if you look at it in multiple ways, so for instance, if you start using different channels of communication, they're less expensive. So to use a chat, you can do 2 chats for every call. The statistics say that the chat is half the time of a call. So you, in essence, are saving money by having these multiple channels. I think the second area is in cost reduction is you think that you have to invest in the capital. I have to build my own phone switch. I have to add my own SMS capability. I have to add my own email, secure email or chat capability, and that can be very expensive when you know your take rate in the beginning will be fairly small. So you look to companies like Teleperformance that offer this, as we say, by the drink or by the transaction, and therefore you only pay for what you use, and you can grow into it as you start to convince members and they adapt to the preferences that they would really like with this multi-channel communication. I think the last thing is in listening to all the presentations this week, and you see all the integration and partnerships at the ACO level with providers and plans and clinics and doctors, and they have so much to think about in helping the member or the patient become healthy. I asked this in one of the sessions, is what are you doing about the cost? Because that seems like a lot of extra cost in the system to try to integrate, to coordinate between these.
To consolidate.
And why not look at someone that does that as their full-time job? We have 182,000 employees. We can offload integration of buildings. We can rebadge their people or insource them, as we call it, and let us do what we do best, which is the administration, the phone, the front office, the back office, worry about buildings, worry about the volumes going up and down to hit those peaks and the valleys as there are in this business. And I think they have to look at it a different way, not as we're outsourcing, but more as a partnership of insourcing what we do best and partnering.
A great message. And any other takeaways you think would be very important to note here?
I think that the future is also going to become much, much more mobile, much more focused on the home, remote capabilities with telemedicine. And I think the whole integration of technology is going to be at a level of complexity that, again, maybe look at partners that have that capability of integrating technology in a variety of channels and a variety of technologies. You don't have to do it all yourself, but really look at a partner. What we think is difficult, our kids think is easy to integrate. And so look at your partner as the same. You, the hospitals, the plans that really know how to improve outcomes and health of their, most chronic and most seriously ill members is where they should be focusing, and let companies in technology and operations and process improvement that run very large operating systems help them in the parts that are not as strategic yet important.
Okay. Joanne Anderson, thank you so much for your time today.
Thank you.
And I'm Mabel Jong. Thanks for watching.